The World Bank report has raised questions on the quality and competence of health workers countrywide, especially those that operate Health Center 2 and 3. Conducted in 400 health centers, the research shows that only 1 out of 10 health workers would correctly diagnose the common disease including malaria, tuberculosis, diabetes, pneumonia, among others.
Whereas doctors are still trained by mainly the big hospitals and the universities, the training of lower level health workers has been, if I can use the word, privatized, in that it's more as the way you go into a vocational institution and learn computer skills.
The report faults the nature of training that the health workers at lower levels go through before being deployed, coupled with the increasing occurrences of quack doctors.
Even in cases where they were able to identify the illness, they are unable to provide the right treatment, as in either telling you, giving you a referral to go to this particular facility, or directing you that you have to take these drugs in these proportions.
Absenteeism of health workers was another indicator of incompetence reflected in the report. The long and short of it all is that services in the health and education sector are not as they should be.
We also try to look at the time the teachers spend in classes. Okay? According to the Ministry of Education, it's supposed to be 7 hours and 20 minutes on a daily basis. So we found that in Uganda, on average, it was about 3 hours.
A committee of inquiry is to be set up to look into the poor performance of the two sectors.
And for us now, in finance, whatever anybody says, I am ready to move the process forward, including health and education. Somebody will say they will not get money until they have reformed. Period. Come on, boy.
Meanwhile, women activists against sex and gender-based violence from Akford have raised concern over the increasing cases of sexual abuse despite the presence of laws.
So have people not understanding what it takes to know the law, what it takes when one is raped or defiled, because we have already shared what happens when one is defiled or raped. You have issues of trauma, you have diseases.
They now want these laws to be translated into local languages.